My name's Louise, I'm a ward sister at an elderly care ward at Heartlands Hospital. It's a very busy, very fast-paced ward, looking after the elderly. We see a lot of elderly with infections, elderly with dementia, some end-of-life care. We're seeing COVID starting to come back through. We wear obviously the aprons and the gloves, protecting ourselves and the patients with the PPE that's available. The biggest change on the ward is there's no visitors allowed onto the ward, so it's reassuring people at home that their loved ones are being looked after. It's important for the general safety of the public to stop the spread of the infection and to keep people safe. It is still very much out there and we need to protect everybody that we can.
My name is Mr. Sadanki. I am a porter. So it's different now with the coronavirus. We need to make sure everything is fine. And we make sure before they go inside the hospital to have the hand sanitizer, wash the hand and have the mask as well.
It's a really difficult time whenever a loved one needs to stay in hospital due to illness, and we really want to know what's going on with them and we want to be there to reassure them. It's even more difficult this year at a time when we've been faced with COVID-19, where we've had to have visiting restrictions in place. We totally appreciate how challenging that must be, but as well as all of our other precautions to prevent infection within our healthcare setting, having reduced visiting has made a big difference in terms of preventing risks to those patients, those vulnerable people already in hospital, but also to you coming into hospital and preventing that risk as well. We know that's the best option at this moment. We are constantly looking at the best opportunity to release those restrictions at a phased approach.
So we have struggled, but I think as a team we're definitely stronger. We lost a colleague and that's made us a stronger team, and that's made it highlight the point that we need to protect people because our colleague was very fit and healthy.
I'm Zach Palmer. I'm a consultant oral and maxillofacial surgeon at the University Hospital Birmingham, and I specialise in head and neck cancer and specifically reconstruction of complex defects. So I contracted COVID very early in the pandemic and it was really very frightening. I was admitted for a few days and then discharged home, and luckily my mother had at that stage gone to live with my sister and did not come back to live with me till I had fully recovered. I still have a fear of passing on COVID to my mother because she's back living with me, but I try and be meticulous in terms of my hand washing and gelling when I leave the hospital, but also once I get home, just trying to reduce the risk of passing it on to someone who won't cope with getting the infection.
So whilst it is really challenging not being able to see our loved ones on a face-to-face level, the Trust has considered alternative arrangements that we can make so you can still maintain that contact with your relative or loved one. So that includes letters to loved ones, which you can access on the Trust website. You can also speak to the nurse in charge of that area to make alternative arrangements. So rather than just a normal phone call, you could arrange for a video call with your loved one instead so that you can still see them and help reassure them via that route.
We also have the parcels for patients, so relatives can send in parcels that their relatives will still receive, trying to keep things as normal as possible without the interaction, because obviously we need to keep both relatives and patients safe. We understand how you feel. You want to be here when a loved one's in hospital. It's important that you still keep that relationship going and that you're up to date with things. We are doing our very best to keep everybody informed.
As someone who is a surgeon within this hospital, but also someone who had COVID and had to be admitted for a few days, luckily not intensive care, what I can say to you is this is a disease that is rapidly progressive and really can affect anyone. All the guidelines and rules within both the Trust and the community are there to try and keep both yourselves and your relatives safe and preventing admission to hospital.